How's it going, guys? It is 1:11 a.m., 12th of April. Here in Japan, we have a pass-level question for hematology for step one. Before we get started, please subscribe to my channel. Really appreciate it. Give it a like. Really appreciate it. Find me on Instagram, mehlman_medical, mehlman_medical, links down below. Find me on Telegram, links to Telegram group and channel down below. Now start the clip. 6-year-old boy, 1 month history, progressive fatigue, physical exam shows generalized lymphadenopathy. Laboratory studies show platelets low, 120,000 per microliter, should be 150 to 450,000 per microliter. Hemoglobin low, 11 grams per deciliter, should be 13 to 17.5 in males. Non-menstruating women, 12 to 17.5. Menstruating women. White blood cells super fucking elevated, 38,000 per microliter, should be 4 to 11,000 per microliter. And we've got a smear here, which I'll talk about as we move to the question, which the following is most likely to be seen in this patient. So should I say blue rod-like structures contain myeloperoxidase? Refers to R rods. Wrong fucking answer. This would be acute myelogenous leukemia, AML. It'll not be a kid on USMLE. There's two ways that AML is going to present. The first is half of questions will show you R rods, okay? And you need to know to specifically look for them, because if you just get a smear and you don't purposely try to look for the R rods, you're not going to see them. But if you know to look for them and you say, where are they? Oh, okay, I see needle-like structures there. Those are R rods, okay? That's half of questions, AML. The other half, they're not going to show you the smear, and they'll just tell you an adult with some sort of leukemia, and they'll say 30% blasts. 50% blasts. That's literally all they'll say, okay? Just blasts, high percentage. Answer is just AML. It's a lot we can talk about, okay? All trans-retinoic acid can be used as treatment. It uses differentiation into mature granulocytes. Point is, wrong fucking answer. Choice B, CD10 plus cells, correct answer. Refers to lymphoblasts that we get in acute lymphoblastic leukemia, ALL, which will be the answer for leukemia in a kid on USMLE, okay? And findings in leukemia in general, non-specific. You can get lymphadenopathy, you may or may not have low platelets, you may or may not have low hemoglobin, but I would say maybe 4 out of 5 questions, your white blood cells are going to be super fucking elevated. And by that, I mean greater than 30. Okay, when you get to 2CK level stuff, you will occasionally get questions where white blood cells can be maybe slightly elevated, okay, more difficult for leukemia. But for step one, as I just fucking said, 4 out of 5 questions, at least 30,000 per microliter. When we have typical infections, like if you just had a strep pneumo or you had some sort of skin infection where you have a mild sepsis, you might creep into the teens, maybe the 20,000 per microliter. But when you get 30s and above, you want to start thinking about leukemia. Okay, you can also get leukemoid reaction, long fucking tangential discussion, made many YouTube clips on this stuff. Oid means looks like but ain't. So you have white blood cell count, 30,000 or greater, means it looks like leukemia, but it's not leukemia, just infection, okay? But a kid who has leukemia on USMLE, that's ALL. And lymphoblasts, you say, well, what am I supposed to make note of here in the smear? Okay, well, these cells look very smooth and uniform, don't they? Basophilic means purple. Eosinophilic means pink. So we have highly basophilic cells with a high nuclear to cytoplasm ratio. The basophilic part is the nucleus, okay? So we have highly basophilic nuclei with smooth chromatin. I mean, I don't know what else to tell you. This is the buzzy smear for ALL. So they want you to know the smears. AML, R rods, as we talked about. CLL, smudge cells. CML is going to be a motley mix. Okay, it's a soup of all different types of cells. Metamyelocytes, myelocytes, promyelocytes. Okay, I've also made YouTube clips on this stuff. So CD10 positive, TDT positive. I mean, those are things you can see in ALL. It's known to show up on the USMLE. So, and it's almost always B cell. All leukemias, lymphomas, almost always B cell, okay? If they want T cell, more rare, things like mycosis fungoides, Sézary syndrome, or you can get a superior vena cava-like syndrome with a thymus lesion, positive Pemberton sign. Point is, not usually T cell. So moving forward real quick, choice C, CD15-30 positive cells, wrong fucking answer, refers to Reed-Sternberg cells. So this is going to be Hodgkin lymphoma. They will always give you a teenager or older who has a painless lateral neck mass / facial swelling. Plus, they'll give you another finding, such as mediastinal mass, which is not thymoma, it's mediastinal lymphadenopathy, hepatosplenomegaly, or they can tell you there's a palpable left supraclavicular lymph node, the Virchow, spelled Virchow, node, okay, Trucio sign of malignancy. That's Hodgkin lymphoma. Wrong fucking answer. Choice D, deficiency CD40 ligand, wrong fucking answer, refers to hyper IgM syndrome. So we've got CD40 ligand on Th2, CD4 positive T cells, which will bind to CD40 receptor on B cells, induce isotype class switching, which means enabling the change from IgM to IgG, IgE, IgD, IgA, etc. So what they'll do on USMLE, if they want hyper IgM syndrome, is just give you a big fucking vignette. They're going to show you the immunoglobulins where IgM super fucking high, all the other ones low, and you're like, well, obviously it's hyper IgM syndrome, and then the answer is just deficiency of CD40 ligand. So they just want you to know that that mechanism is simply hyper IgM syndrome. In this case, wrong fucking answer. Choice E, granulocytosis, wrong fucking answer. So USMLE wants you to know reactive granulocytosis. That phrase refers to leukocyte reaction, as I talked about before. Okay, and you're going to get a smear which shows neutrophils. You get neutrophilia. So a leukocyte reaction is a disproportionate / exaggerated immune response where you get increased leukocyte release from the bone marrow reserve pool. Okay, so rather than just having a simple leukocytosis in the teens or 20s, it's 30 or above. Okay, and you're, as I just said, neutrophils on the smear. They really like that. You can get a high leukocyte ALP, but granulocyte refers to neutrophils, eosinophils, basophils, but the term is essentially synonymous with neutrophil on USMLE. That's how it's used. So, for example, tangentially, agranulocytosis just means neutropenia, okay? Or granulocytosis means neutrophilia, too many neutrophils. Wrong fucking answer. You know the deal. To make more content, like my stuff, subscribe my channel. And I appreciate your time. That's it.